Okay, I guess the very first video, the first couple of videos are gonna be about basically what I've experienced so far in these. I've been in 3 nursing homes and 4 rehabs since I've been diagnosed. So I'm not an expert, I guess. I've only been a couple of years, I guess. But I'm not exactly naive when it comes to nursing homes and so forth. I've researched the state and federal laws as far as it's concerned, and that's only because of the horror stories I heard about it. Prior to this, with my grandmother, and I guess just mainly my grandmother, they really did a job on her as far as her insurance and stuff goes. So I've looked up to the state and federal laws concerning people who are residents, long-term care residents, and the CNAs and nurses and so forth. And I was looking at what time it is because I heard it sounded like a cart went by. See if we're having lunch. I don't want anyone to come in here and catch me talking to my phone. Yeah, again, in case you didn't watch the one where I have the beard and everything, I don't have my computer here. I won't be doing any editing. So what you see is what you get. Okay, I'm going to start off talking about some of the crap I've noticed as far as, I'll just go with this nursing home, the stuff that's the same with the other nursing homes, but one big problem is that the CNAs, which are certified nursing assistants, they have to go to school, they have to get certified. They don't go to college, I don't guess. Because LPN, I think, is the first college that's an associate's degree, I believe. And then you have RN, which is like a bachelor's degree. And then you have nurse practitioner, which is, I believe, a master's degree. As an RN, in order to, do prescriptions and so forth. So that's basically how it works. And then they have what they call med techs here. And that's basically a CNA that gives you pills. But there's only certain medicines they can give out, I guess. That's a little confusing, but the problems I've had are basic. I hope you can't hear that, because I can't edit, so I'll have to start all over again. The CNAs. Okay, there's many problems with the CNAs. And really what it comes down to is bad habits, being taught incorrectly because of bad habits. You have some CNAs who are full of themselves and think that they don't have to do certain things because they're a human being, blah, 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 But the bottom line is a CNA does everything medical that has to do with you, as far as, I call it scut work, but that's like what you would have a private in the military do. That's doing all the cleanups and all the stuff that LPNs and the RNs don't want to do. That's what the CNA does. Cleaning up vomit and, changing adult diapers and, all that kind of stuff. Well, we have CNAs here that it's like, first of all, let's just start at the beginning. The very first thing I noticed was that as long as everything is convenient for the CNA, that's what the CNA wants to do. For instance, I have 3 flat surfaces, 4 really. Flat surfaces in here. One was a table I brought in here myself because every other flat surface in here has crap the CNA's left in here. You have stuff that's over here, trash bag, used gloves, towels, and over here we get soaps and lotions, and well, they even use my tabletop. Not all the time, but most of the time. And then you go into the bathroom, and there's a shelf in there, a big long shelf that you can't use because there's no shower in there. There's only the bathroom. I can't use it because I'm stuck in this chair. I can only use a urinal, that kind of thing. So they've got a big shelf in there that has a couple of soaps on it, and that's it. They could use that shelf, put everything that they have in there on that shelf instead of leaving it lying all over the place. But as long as it's convenient for the CNA, that's what they do. Now, CNAs, what they should be doing is keeping this place neat. See, because we are what's called residents. And the reason that we're called residents is because this is where most of us are going to spend the rest of our lives. Here. For some, that's only, a couple of days. And for some like me, it's going to be potentially a couple of decades. At least one, probably, unless I'm lucky and I die early. But it's going to be probably a couple of decades. So when he called me a resident, that's because this is where I'm going to live until I die, more than likely, unless I find a better nursing home that I get accepted to a better nursing home. This is it. So when I come in here and I see that the CNAs don't care about leaving a mess in here, that bothers me. When I come in here, well, that's enough of that. Anyway, one of the other things I've noticed with the CNAs is that, well, first, CNAs have an attitude with you. And it's almost as if in their mind, you're just a visitor in their work environment. And it's actually not that. As I said a minute ago, we're residents here. They're the ones that are the visitors, but they act like it's the other way around because they work here. I kind of understand that, but the problem really is that they're not thinking about it correctly. This is where we live. They're the visitors. They're the employees. It's basically the same thing as if I had a mansion and I had a cook and I had a maid that cleans up and I had a butler who does random stuff. That's basically what you have here, except you have multiple people living here. Maybe like a hotel. That's probably about right. It's like a maid service and, you have a cook staff and you have the concierge. It's kind of like that, except you also have medical treatment and stuff. But the CNAs here, they don't seem to see it that way. They seem to see it like, I don't know, like this is where they belong. You're the one who visits. And it's not true because some of them have been here for, a couple of decades. But some of them have been here for like a couple of months and they'll be gone next week, next month, whatever. But we still have to put up what they think is their right. And it's really not. We're the ones who have to have the rights. There are laws that govern how people are supposed to be treated when they're in a nursing home. There are no laws that say how CNAs get treated when they're working in a nursing home. There's nothing like that. I mean, other than regular old laws that have to do with every male and female on the planet. So CNAs need to think about, well, everybody who works in a nursing home needs to realize that they're the visitors. The people who live here are the ones who stay here. They're the visitors. They might be here for a couple of weeks. They might be here for a couple of months or years. But I, for one, will probably be here longer than anyone else in this building, to include residents. There are a couple of CNAs here that have been CNAs in this building for a couple of decades. Other than that, if there happens to be somebody like that, it's just going to be me. Therefore, this is my building, not theirs. But they act like it's the other way around. That is a huge problem. That's a huge problem. I've had CNAs tell me to shut the fuck up and slam the door on me, and they don't seem to realize it. The one I'm thinking about in particular is really new here. He just started here about, I think, a week, maybe two before that, something like that. And he shouldn't have said anything at all, because anytime you're disrespectful to a resident, or you retaliate against a resident or anything like that, anytime you're not just cordial with them and treat them very businesslike, and even be nice to them, some of them, that's a good thing. You don't have to be nice, but it's good to be nice. But if you're mean to them at all, that's a felony. That's against the law big time. And for somebody to continue to employ somebody like that, you're putting the entire facility and everybody who works in it and lives in it at risk, because that is what that guy did is so serious. They could shut this damn place down because of it. Because not because of what he said, more than what the fact that he's still here, that they continue to employ him. That puts the entire facility at risk. That means that if somebody were to say something, you would have to go to court, or you would have to deal with the officials, let's say, and explain yourself. And other than it being his word against mine, that's the only thing that would be a saving grace, is if they tell people, well, I didn't believe that he was telling the truth. I don't think he would ever say that or do that, which he did. But that's the only way that they would be able to pull their ass out of the fire. But things like that is, like, he thinks he's completely in the right for saying that. No, he was not in the right at all. As a matter of fact, I haven't put him in prison for that. For a few years. And I still haven't, because I just realized a couple of nights ago that he's still here. So I still haven't decided whether I'm going to report him to the state or not. Because right now they're talking about canceling Medicaid and stuff. And this place might not even be open in a week. So I'm waiting to see how that shakes out, really. But moving on, there's that attitude that this is my place of work. You're just one of the patients here. They need to change their attitude. They need to realize that we're your residents here. There's some that have been here the whole time I've been here, which means they've been here at least a year. That's long enough. I mean, that's not like when I was in the hospital and I was there for a month. That's kind of short term. That's long term for a hospital, but it's really short term. When somebody says, when somebody's here for more than a year, that's long term. You don't treat that person like they're nobody anymore. In that particular situation, the fact that the law says we're residents, they should right off the bat treat us differently. I'm just saying, as far as normal people go, when somebody establishes that they're in a place, you should be treating them different. So if for no other reason than that, that's why they should be treating us different. I have a different attitude about the whole thing. So I talked about that, how they leave stuff everywhere. I don't know why, but they keep this. There's a hospital table, which this camera is sitting on right now. And this hospital table is where I keep stuff. It's because I can't really move in the bed. I can barely reach stuff that's on the table. It's next to my bed. But it's very important because it has wheels that I can move it around in there. And they seem to some of them get angry because there's no room on the table because I got stuff on there. Because when they come in here to change my linens or whatever, I put my stuff on that table and push it out of the way. Like my headset, my water, my drinks, whatever I happen to have. And they seem to get upset because I'm using that table. And I'm like, well, there's enough surfaces in here that you could use one of those other surfaces, but because it's not right there next to you, that's going to slow them down to what? 2 feet across the floor. Again, it's whatever's convenient for the CNA. And don't get me wrong, I like some of these. I like quite a few of these CNAs. It's bad habits, and it's a bad idea of what things are like around here. They need to understand that we're the residents, not them. I keep repeating that because that is a big deal. If they would just think about it the opposite way, that they're the resident, we're the residents, they're in our homes, I think that would change a lot of things that they do wrong. Just that one simple changing of the mind. So they get mad about that. They get mad about using the table. They get mad if I put stuff anywhere. If they can't put something down, whether it be on this chest of drawers that they gave me or my table, they get mad. They like throw stuff, linens or these gowns or whatever. They just throw it right on top of my stuff. I'm like, what the hell are you doing? That's how stuff gets broken, is by you just not caring and putting it down because you got to use it. It's not about what's convenient for you. It's about what's convenient for me. Then I have a reacher that I use to grab stuff off the floor and stuff like that. It took me weeks to get them to start putting the damn thing where I could reach it. They kept putting it on the other side of the room when I was in the bed and I couldn't get to it. Things like that. It's just little things, little crappy things that they're doing that they don't think is a big deal. But we have to put up with it as I said to the director of nursing, a CNA can complain about the way we treat them during their shift. But what they don't seem to realize is that we have to put up with 3 shifts of sometimes a CNA for several days on 3 different shifts, 3 different CNAs for several days, treating us, doing the same, making the same mistakes with us. So by the time, a couple of days goes by, we're getting pretty angry about the way that these CNAs are acting. So we'll snap at them. I personally, because of the MS burning out my temporal lobe, it's hard for me not to say something. I can, as long as I have the presence of mind to hold my tongue. But if somebody surprises me and I have a reaction to it, a knee-jerk reaction comes right out. And sometimes it's not even something I would normally say to somebody. It's just a thought you have briefly. But because your temporal lobe burn out, your ability to control impulses is lessened severely. You end up saying stuff that you probably wouldn't have said, or doing stuff that you probably wouldn't have done, that kind of thing. And the CNAs don't really understand that. And that's, I guess, the other thing is that there is none of these CNAs or nurses, for that matter, even understand what I'm going through, or what some of these people are going through. Like Alzheimer's, okay, they forget stuff, and eventually it will kill them. Some of them probably know a little more about it than others, but every single person here, because this is a medical facility, every single person here who deals with a resident should understand exactly what's wrong with that person and exactly what to expect from that person. Because from my perspective, they don't at all. I've had nurses come in here and say, jump on me about stuff. And I'm like, do you understand that's because of my disease, because I have MS, that I'm acting like that? Or that I'm doing that? Or that I'm having you do that? Or whatever the case may be? They don't get it. That's because nobody told them about the disease I have. If they're treating me medically, they need to understand I could choke at any time. I could stop breathing at any time. And they don't. Here's the other thing. They don't answer the call lights. I mean, they're a lot better here than they were at the last nursing home I was at. But nothing like they were at the other, when I was in Indiana, I was in the rehab facility in the nursing home up there. They were within 3 minutes. They'd be right in there. Every single time I said like somebody was in there. Here, sometimes I can go hours without seeing a light get answered. The other places, that was pretty common. Over here, hours is not as common as 15 to 30 minutes. But they're supposed to answer it in like 3 minutes, 3 to 5, and 5 if they're busy with somebody else or whatever. But they're supposed to answer it right away. And that includes everybody who works here. Even the housekeeping, the maintenance man, if they see a light come on, they're supposed to come in and make sure that you're still alive. And then obviously, if you're like the maintenance man, you have to say, hey, I'll let your CNA know. They have to come in here, that kind of thing. But they need to, at the very minimum, answer that light, make sure that there's nothing seriously wrong with you that they have to call an ambulance. That's what they're supposed to do. But and it's because they're so used to it not being an emergency. They're so used to it not being an emergency that they kind of treat everybody like that, when sometimes it is. I'm sure some people have been choking or whatever and hit their call light, and by the time somebody walks in there, they're dead. They're gone. And they don't know what really happened because they didn't bother to come in there to find out. And then they're surprised because the person died. I'm sure that happens. I know it happened in the last nursing home I was in. Okay, they're not answering call. Another thing is we're required by law, we're supposed to be able to, and this is going to be in another video when I talk about the kitchen, but they're supposed to give us meal. And I don't know how many times I've talked to the CNA and or the nurse about the kitchen not giving me the meal I'm supposed to have, and saying, hey, that's against the law not to. Well, near as I can tell, there's a loophole that they can get through by saying, oh, we have a third party come in and do that. So now they're no longer responsible. I believe that the CNA and the nurse should go down and get you something. Some people do it, some people don't. When I first got here, they're like, well, what do you want me to do about it? What do you mean? You have to do something about it. I can't, and so it's like that with a few things. And it's like, the person you're here, the reason you're here, aside from the nurses and the medication, let's say the CNAs, is to do things I can't do. That's everything. That's not just, pick something up for me or change my linen. Your job as a CNA is to do anything I need you to do for me, because I can't do it for myself. And they don't seem to get that. It's like whatever's normal, that's what they're going to do, not everything. And that's what they're supposed to do. Oh my God, I hope you can't hear that. To include bathing you. I had a girl here, she was doing a great job. She's fantastic CNA. And I tried to encourage her, told her her hair looked nice, she's a good person, all of this stuff. And then out of the blue, and in my youth, I used to flirt with everybody. I was they call them a dog, or well, in my day, I don't know what they call them now, but a womanizer. I used to do that a lot. So there are girls here that I flirt back and forth with. I don't know if they're doing it intentionally or not. I assume, because that's the way I always used to do it. And then there are some that, like this one girl in particular, who I think is really good. and she's young. She just got certified. And honestly, to be selfish about it, it's because I know that she's just starting out and she's still young. That hopefully for years to come, she'll still be able to do things for me. So I want to be as friendly as I can with her. Well, out of the blue, all of a sudden she tells a nurse that I'm sexualizing her. I had no idea what the hell they were talking about. So I kept trying to get this nurse to tell me what she's talking about. Then the things that she said at first were like I thought were a different conversation. I'm like, well, that's not even her. That's not even, what are you talking about? So then she said something about jeans. So then the next day I said, wait a minute, when you said something about jeans, because I thought about it later, I said, is that the conversation? Is that the sexualizing you're talking about? And I was thinking of one thing. And she said it was something different. And I went, well, that was like months ago. What are you even talking about? And then the next day I found out it was evidently about washing me. Well, when I first got MS, I got infections really bad because I didn't realize MS is, at least kind of like I have, it's kind of like your entire body is partially Novocaine or something. So I had no idea that I was scratching myself. And I was scratching myself with my fingernails in places that sometimes I couldn't see. And I was getting really bad infections to the point where my legs blew up and they had to put these weird wraps on my legs for months before they finally went down and went away. They had to give me antibiotics, IVs, and all that stuff. And I talked to a doctor and he said, well, first he said that I had to be careful, don't scratch myself anymore. And I said, well, I'm not doing it intentionally. I don't realize that I'm scratching myself. I still do it when I'm trying to stretch my legs and stuff. But he was like, well, I was lucky that it was my legs and not like, I don't know, my face or, my junk. Let's say that. Because, the scars on my legs are so bad that I might have lost something. So, he's telling me that I need to, if that's the case, that I have no idea if I'm scratching myself, which is the case. And then I need to stop washing myself. I need to have somebody come and do it for me. So for a couple of years, when I was at the house, I had somebody come into the house once a week and they would wash me down and, make sure I'm clean at least that day. They couldn't come every day, obviously, because insurance, there's limitations on that. But so now that I'm here and they wouldn't let me use my urinal, I can use theirs. It's really difficult for me to use theirs, but I can use theirs versus the other nursing home owner that I couldn't use it at all. I ended up cutting myself really bad. But here I can. I just found that out. I assumed that they still had the urinals like at that other place, but this one doesn't cut me. So before that, I was wearing adult diapers because they wouldn't let me use my own urinal here, and they were constant. I was in a lake of urine for over a year, because of this. So I was expecting the CNAs to clean me up every time that they had to change me or whatever. And I didn't assume anything of it because the doctor that originally told me to have somebody else do it, I said, well, I don't want to tell him. I was kind of having a little argument with him. I said, I don't want to tell people to do that because it makes me uncomfortable to tell somebody, and usually it's a female that's a nurse or a CNA or whatever. There are a couple of guys here, but mostly they're females. I don't want to tell the female that she has to touch me and stuff like that. And he said, well, why not? And I said, well, because she's a female. And he said, well, that's her job. If she doesn't like her job, she has to find another one. And I was like, all right, well, that was 8 years ago that guy Well, actually, they got 8 years I've been crippled. But I've had, even back then, when I first went in the hospital, I couldn't do anything. Because you just touch me, I would bend in half because the MS, I would literally bend over backwards in the shape of a C. I had no idea I could bend that far. But I was bending over backwards until the nurses would come in and they would have to like stretch me out or something. Well, they would have to clean me and stuff too in the beginning. And then there was a time where I was an Uber driver and I did everything myself. And then I had another relapse and I'm back to where I can give myself infections and stuff. So the doctor, that when he told me that I had to hire somebody, told me that it was their job, that's what they're supposed to do. And I remember from the other place, that's what they did. Except the other place, they were all nurses. They were all RNs. So I never really dealt with CNAs until I came here, down here in Alabama. So the doctor said, well, that's their job. That's what they're supposed to do. So that's the way I've looked at it all along for the last, 4 years? That I've had 2 years, I had somebody come to my house. And they weren't even a CNA. Come to find out later, they were just somebody who answered an ad in the paper. I thought they were actually CNAs. Well, nursing assistants. I didn't know CNA certified. I didn't know that was a thing until probably went to the hospital the first time a couple of years ago. But anyway, doctor said it's their job. That's the way I've looked at it the whole time. Well, this one girl, all of a sudden out of the blue, after I've been here, I think she was here maybe around the same time as me. So about 7 months, she's come in here, she's changed me, she put me in the chair and all that. Just all of a sudden out of the blue, she's like, he's sexualizing me. Because I had her put some barrier cream on me because I've been sitting in all like a urine for a year. And nobody's been doing that. And they're supposed to put barrier cream on you all the time so you don't get what they call like bed sores and that kind of thing. And from being trench foot in the military was a big problem. If you didn't change your socks all the time, keep them dry. It's the same basic idea. The barrier cream keeps humidity away from your skin so that your skin doesn't start to lose its what do they call it? Tension or whatever. So she did that. I come up with a solution to where I can wear, as long as they'll buy them, because I bought them before and they were very expensive. So the insurance is going to have to take care of it now. Getting me gloves that